Welcome to Health Hour, a session for you by Black doctors, hosted by the Caribbean and African Health Network. Ever sat in a doctor's office thinking, they just don't get it? Or search for health advice online, but you can't understand it? Felt unheard? You're not alone, and you found your solution with Health Hour. Every Saturday at 11 a.m., this is your space where Caribbean and African healthcare professionals speak about health with a focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more. All with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health expertise.
Sorry, that was a minute. Hi, good morning, everyone. Hope we're all having a lovely Saturday. The weather's really lovely. My name is Tayo, and I'll be the host for today's session. So we'll just dive straight into it. Today we have Dr. Joan. She's a GP with a special interest in diabetes, working as a diabetes clinical lead in Northwest London. She is the clinical advisor for Diabetes Africa and one of the first Diabetes UK clinical champions. With over 30 years of experience working in Brent, one of UK's most diverse boroughs, Dr. Saint John is a passionate advocate for diabetes prevention and education. So please make sure to, as always, drop your questions in the chat or keep them right to the end of the session, and then we'll go through them at the end. Thank you so much. Over to you, Dr. John.
Thank you, Tayo, and welcome everybody, and good afternoon, good morning, good evening, wherever you're joining us from. I'm going to try and share my slides. So, Tayo, can you see that okay?
Yes, I can.
Yeah, and whole screen, yeah?
Yes, whole screen, full screen.
Okay, so thank you very much. I really appreciate Khan inviting me to give this conversation, really. I hope it's going to be a conversation this afternoon, this morning, I should say, about diabetes prevention. I'm going to focus particularly on people of African Caribbean origin, but this is universal information. It applies to most people, because what we want to do is to empower our communities through knowledge. So my name is Dr. Joan St. John. I am a doctor with specialist interest in diabetes and health inequalities, co-author of the Carbs and Cals World Foods, one of the clinical advisors to Diabetes Africa. I host a webinar series with Diabetes Africa called Diabetes Health Matters, and I'm a Diabetes UK clinical champion. So as you can see, I'm pretty passionate about diabetes. And Tayo, I'm going to ask you, please just keep me on track in terms of the time.
Yes, we will do.
in case I go on for too long.
No worries.
So today we're going to be talking about diabetes prevention. Why we're going to talk about that? We're going to talk about it because the 25th to the 31st of May is Diabetes Prevention Week. And we're going to talk about some background. So to put things into context, we're going to talk about risk factors. We're going to talk about what you can do. And also, I'm going to provide some resources for you as well. So let me just ask you this question. Do you think you can prevent type 2 diabetes? Well, I hope the answer to that is yes. But I ask the question because I think sometimes people think, it's going to be inevitable, that they a lot of their family may have or be living with type 2 diabetes, and they think, well, it's going to happen to me. But there is a lot of evidence, and I will share that with you, to show that we can delay, we can prevent, we can stop type 2 diabetes developing. Why do I say that? There's lots of evidence, huge, strong evidence throughout the world about prevention and the particular things that you need to do to prevent type 2 diabetes developing. If you can see on this slide, whether you talk about studies that were done in China, in the US, in Canada, in the UK, in Sweden, Australia, Japan, all over the world, diabetes prevention studies have been carried out. Nearly 15,000 people have been involved in these studies, talking about 30 odd countries involved in this prevention. And the important thing is that diabetes, type 2 diabetes, can be prevented. And why do I say that? So these nearly 15,000 people that were involved in these studies, when they did these studies looking at the particular behaviors that's involved, there was a 50 odd % reduction in the incidence of type 2 diabetes with these methods. It's vitally important. It's so important. And it was one of the things that really spurred me on when I started working or focusing on diabetes over 20 odd years ago. These studies were happening at that time. And this 58% that you can see in the US study, it was more effective at reducing the risk of development of type 2 diabetes than actually taking medication. So it was, to me, it was so exciting, so fascinating that by doing certain behaviors, you could reduce the incidence of type 2 diabetes compared to giving somebody medication. And as a healthcare professional, I found that really exciting. So the key finding is that these lifestyle interventions consistently reduce the incidence of type 2 diabetes risk, real world by about 30%, and in the studies by about 60% across globally. So that's a diverse populations. Why does it matter to us as a community? Well, it's really important because we, as African Caribbean people, are 2 to 4 times more likely to develop type 2 diabetes than other communities, if we talk about white populations. As I just showed you from that really strong body of evidence, and we're going to base the presentation today on that strong body of evidence, up to about 50% of cases of type 2 diabetes can be prevented through lifestyle changes. And it's important to notice that if you are at risk of developing type 2 diabetes, that you may be living with type 2 diabetes, but not knowing about it for up to 10 years before it actually becomes manifest and you get to know about it. In those 10 years, what's happening? It can be doing silent, undetected damage to your body, to your organs. So that's why it's vitally important to know whether you're at risk and to know whether you have type 2 diabetes, whether you're living with it. Because from the top of your head to the tips of your toes, it can be doing damage to your organs, to various parts of your body. You may know that it can do damage to your kidneys. You may know that it can do damage to your heart. You may know that it can do damage to your nerves, but some people don't know that it can damage your brain. It can damage your skin. It can damage your thinking, your blood vessels, your sexual function. And these are all important parts of life. And so it's really important to be aware of whether you are living with type 2 diabetes or if you're at risk of developing it. Important thing is it's not inevitable. Prevention is definitely possible, and it's what those key steps are. That's what we're going to talk about today. So how would you know if you're at risk of developing type 2 diabetes and whether you've got a low risk, a moderate risk, a high risk? What do I mean by that? So what are the sort of risk factors that you need to look out for? For our community, as a community, we are at increased risk. We have about a 2 to 4 times increased risk when you compare us to a white population. For South Asian people, people of South Asian heritage, it's somewhere between 3 and 6 times the increased risk. For us, it's somewhere between 2 and 4 times the increased risk. So what are the risk factors for us as a community? What do we need to look out for? If your parent, your brother, your sister, a close relative is living with type 2 diabetes, then it increases your risk up to about, it can increase it up to about 40%, depending on which part of your family is affected by type 2 diabetes. If you're carrying excess weight, and I'm going to say more about this later, but if you're carrying excess weight, that can also increase your risk of developing type 2 diabetes. High blood pressure, which a lot of us live with, is another risk factor that can increase your risk of developing type 2 diabetes. It's not certain how they're connected, but they are certainly connected. They tend to go hand in hand. So if you're living with high blood pressure, you've got increased risk of type 2 diabetes. If you're living with type 2 diabetes, you tend to have an increased risk of developing high blood pressure. For our community, and I think this is something that has really become apparent over the past 20 odd years, we're at risk of developing type 2 diabetes at a younger age. If you consider about sort of 25 years ago, we really didn't know of what we call young people developing type 2 diabetes. This can be people who are as young as 18, 19, and certainly below the age of 40. It wasn't really something that we used to see as healthcare professionals 20 odd years ago, but now we certainly are seeing an increased rise in incidence of people around the age of 25 and above, or sometimes even as young as 18 or 19, developing type 2 diabetes. What goes alongside that? Being inactive in terms of the lifestyle. And a really important risk factor is if you develop diabetes during pregnancy, that certainly increases your risk about 20% each year afterwards of developing type 2 diabetes. So those are the risk factors for us as a community. But it's not just about risk factors, because obviously what we want to know is what we can do about it. So one of the things that you can certainly do is find out whether you're at low, medium, high, or very high risk. And what do I mean by that? So there's a risk calculator, which says 2 minutes, 2 minutes of your time to understand your risk of developing type 2 diabetes. It's going to ask about 6 or 7 questions. It requires you to have a tape measure, and I require you to have a tape measure today, because when we're talking about what you can do, a tape measure or a piece of string, and more will be revealed later, is one of the ways that you can determine your risk of developing type 2 diabetes. Okay, so let's talk about this Diabetes Prevention Week risk calculator. If you scan the QR code, it will give you an indication when you go through those 6 or 7 questions of whether it's low, medium, high, or very high risk. It will ask about things like blood pressure, as I mentioned to you before, that can increase your risk of developing type 2 diabetes. It will ask about your family history. It will ask about your ethnicity. It will ask about your weight. It will ask about your age. Age is one of the other things that can increase your risk of developing type 2 diabetes, but we can't do anything about that. So that's something we've got to live with. And then it will give you a calculation of whether you're at low, medium, high, or very high risk. Alongside asking you the questions, it does tell you why it asks the questions and how those factors can increase your risk. And it then at the end of that, let's say you've got a high risk or a very high risk, it will enable you to print off a letter that you can take to your GP practice, and that will then enable them to see that you're at high risk of developing type 2 diabetes or very high risk, and do a blood test, because the blood test will tell you definitely where you are in terms of your risk. What do I mean by that? So the blood test is called the HbA1c. That's not important. It gives you an indication of what your risk of developing type 2 diabetes is. And I've used a traffic light system here. Traffic light system to give us an indication if everything's okay, if there's a risk, or if you're actually living with the condition. So if your blood result is normal, it's going to be less than 42 millimoles per mole. That's the key figure that you have to remember. Normal for your blood test in terms of an HbA1c is less than 42 millimoles per mole. Now, if you have what we call prediabetes, the full name for it is non-diabetic hypoglycemia. You might have heard of borderline diabetes. That's between the figures of 42 to 47 millimoles per mole. So that's in the amber range when we're using this traffic light system. But if it's 48 millimoles per mole or above, that means you actually may have type 2 diabetes. What would happen is that you would have another blood test unless you've got specific symptoms, and that will confirm whether or not the diagnosis is there. So today we're concentrating on the amber range. You know, if you're living with prediabetes, the important thing, as I said to you, is not inevitable that you're going to develop type 2 diabetes. You can actually get back into what I've described here as the green range and get your figures below 42 millimoles per mole by doing the certain activities that we're going to talk about in a minute. So key thing is a blood test. It will show whether your blood levels are normal, whether there's some risk of developing type 2 diabetes, or whether you're living with type 2 diabetes. So here's where the string or the tape measure come in. So this is something you can do when we've finished the presentation today. It's a bit like Blue Peter, isn't it? So what's the relevance of the string and the tape measure? Well, the relevance is waist circumference. It's so critical to talking about prevention of type 2 diabetes. If you are carrying excess weight, where you carry the excess weight is vitally important. If you're carrying that excess weight around your waist, then it's going to put you at increased risk of developing type 2 diabetes. So if you don't want to do the risk calculation, you know, you think that it's too much to answer the questions, or you haven't got the 2 minutes to spend the time doing that, there is a simpler way that you can do it. You can literally measure your waist. Now, measuring your waist is not about your jean size or your trouser size. It's not that. It is actually about measuring the actual waist. So imagine and have a feel now, actually, your ribs. And if you can't feel your ribs, then there's an issue there, okay? So feel your ribs and try and feel the lowest rib that you can, okay? Then what I want you to do is feel your hips and try and feel where your hip bone is. And halfway between those two, so halfway between your lowest rib that you can feel and the top of your hip bone is where your waist is, and that's where you should measure your waist. And again, we've got the traffic light system, as you can see from my family members. One is in green, one is got in red. What's happened here? So one has got a waist circumference which is greatly increased risk. So for a man, that's 102 centimeters. For a woman, that's above 88 centimeters. A healthy waist circumference for a woman is going to be around or less than 31.5 inches or 80 centimeters. For men, it's going to be equivalent to or less than 37 inches and 94 centimeters. And as I said, you know, it's not about your trouser size or your skirt size or jean size. Now, even more discerning way of understanding whether your waist is the right size for you, because it's a very individual thing. We're learning more that there may be sort of critical fat mass for each individual. So one of the ways that we can discern whether we're at a healthy size is something called the waist to hip ratio. This is where the string comes in. So if you were to have a ball of string and you take it from the top of your head and you drop it down to the ground, okay? So you don't even have to measure it. Just drop it down to the ground, okay? You cut off that length of string and you halve it. That string should now be able to go around your waist. If it's not able to go around your waist, it's saying that your waist is too large for your height. Or let me put it another way. Your waist should be half, at least half, sorry, I should say no more than half of your height. So your waist should be no more than half of your height. And it's an easy way to see if you're carrying excess weight around your waist. Why? Because carrying excess weight around your waist is what we as healthcare professionals call metabolically active. We know that that can increase your risk of things like type 2 diabetes, heart disease, and conditions associated with your circulation, which is not helpful for your future health. So waist should be half of your height. So as we said, the waist size matters because it gives us an indication of where you're carrying excess weight, if you're carrying excess weight. I haven't, as you notice, said much about body mass index, BMI, because it's not as discerning in terms of determining your risk as the waist circumference and the waist to height ratio is. But let me point out to you that if we are going to use body mass index, increased risk of developing type 2 diabetes for us as African Caribbean heritage populations starts at a body mass index of 23, not 25. Okay. So just to point that out. So the risk starts to increase at those body mass index levels. Being aware of the signs and symptoms of type 2 diabetes is obviously important. So increase going to the toilet, increased thirst, fatigue, blurred vision, slow healing cuts, changes in your skin. Those are the other things that you need to watch out for. So what can you do? We've spoken about weight. I didn't give you like an actual figure. I didn't say to you your weight must be above a certain amount because I'm not going to do that. What I'm saying to you is you can determine if you as an individual are carrying excess weight by determining your waist circumference and your waist to height ratio, and you can do that with a piece of string and a tape measure. So let's go on to talk real high-tech stuff. So let's go on to talk about physical activity, and we'll also talk about diet. So as we said, excess weight means excess risk. Getting your steps up to get your risk down. I think it's a good way to look at it. Move your body, because physical activity is one of the most powerful prevention tools that there is. In those large, global, widespread studies, physical activity was one of the key components to the program that they used throughout the world. Okay, so it's a really important thing. How does it help to prevent type 2 diabetes? Well, the movement helps to improve what we call insulin sensitivity, because muscles can mop up, I'm using very simplistic terms here, but mop up the excess glucose that is in your circulation if you're at risk or living with type 2 diabetes. So if there's too much glucose, remember those blood tests that I spoke about, the HbA1c, if there's too much glucose in your blood, muscles can help to mop up some of that excess. And so using your body, using activity can help the muscles to help your body to be more efficient about getting rid of excess glucose out of your circulation system. It can help to manage your weight. It's hard to lose weight just through exercise, I have to tell you that. But if you can get your weight down, it helps to keep your weight down. So it's really important to do that. It burns some calories, it builds muscles, and it reduces your diabetes risk. We spoke about blood pressure and the connection between blood pressure and diabetes. Regular physical activity helps to lower your blood pressure. It helps to reduce stress. It improves your sleep. It really is a win-win. And I think what the great thing about exercise is as well, activity, is that there's something for everybody. You know, you don't have to put on the lycra and go down to the gym. There's something that you can do. We suggest, and the program's found, 150 minutes per week is what is critical and what is key. And it sounds like a huge amount, but if you break it down, to 5 days a week, then it will be 30 minutes in the day. And if you break it down to 10-minute bits of exercise, then you could do 10 minutes in the morning, you could do 10 minutes in your lunch break if you get one, you could do 10 minutes in the evening. So how could that look? The 10 minutes could be something that you can do on a screen, looking at a screen, and there's lots of resources out there for 10-minute snippets of exercise that you could do. Lunchtime, could you go for a walk? If you're going shopping, can you walk to the shop instead of getting the bus? Can you get off the bus a few stops earlier? If you're driving to the supermarket, park your car as far away from the entrance to the supermarket as you can do, not right at the entrance. You know, there's ways that you can do it. The other really, really helpful thing that you can do when you've had your evening meal, can you do some activity for 10 minutes after that? Really beneficial to reducing blood glucose. So, you know, whilst you're watching the soaps, get up and move around. Just walk on the spot, do something. Don't just sit on the couch. So there's lots of things that we can do. Afrobeats and soca dance classes. I love dancing. I love a good track. Put on the music that you enjoy. What would 10 minutes be? 3 tracks, or depending on the track, sometimes it's 2 tracks. But you can put on some music, have a dance in your kitchen, have a dance in the privacy of your own home, and you're going to burn some calories. But you can be more social about it as well if you want to. So things like walking groups, football, netball, cricket, things that we love. You can actually, if you're of a certain vintage, do walking football. You can do walking netball. And I think you can do walking cricket as well. Gardening, allotments, growing your own food. So you're getting a win-win there. You're not just doing the activity, but you're also enjoying the outdoors, nature, and growing some healthy foods as well. And of course, faith is really important. So working together with your faith community, with your community, and you can do some exercise groups there as well. Everybody get healthy. So let's talk about how you can eat well and live well, because we can nourish our bodies, and our heritage foods, our traditional foods, are really important in that. I just thought I'd put some traditional foods there. It's coming up to lunchtime soon, but I just thought we have to celebrate it. Our food is fantastic. Our food is health giving. It depends how much of it you eat. It depends how you prepare it. As a general rule, if you can have a healthy plate, what does that mean? What does that look like? So trying to fill half of your plate, I mean, I know this has got fruit on it, so just disregard that, but half of your plate with vegetables. Just imagine the round plate and having half of it full of vegetables. If you can try and do this for most meals, a quarter of your plate for the starchy foods, and that can be your rice, your yam, sweet potato, plantain, whatever your starchy food is going to be. And then having a quarter of your plate for lean protein. So that can be lentils, it can be fish, it can be chicken, you know, whatever you prefer. But trying to keep that as a general rule will tend to keep you on a healthier way. eating a rainbow of foods is one of the ways that you can be healthier as well in terms of what you're eating. And never forgetting about portion sizes, because portion sizes may be one of the critical things to help you to be healthy and also perhaps, if necessary, to lose weight. Remember I said there's absolutely nothing wrong with our food. Our food can give us great health, but it's how you prepare it, how much of it you're eating that can sometimes affect us. So sometimes grilling or roasting or baking instead of frying or deep frying can be a healthier way to prepare it. Steaming can do that as well and keep the nutrients more intact. Using different types of herbs and spices to season food, as opposed to just using things like salt, or using the little cubes as well. Reducing the sugar that you add to drinks. I know of people, and raise your hand if you have more than 3 spoons of sugar in your tea, because I know of people who have 5 spoons. But maybe we could reduce the sugar in the drinks, and that can help as well. Having lean cuts of meat, removing things like the skin from chicken can also help, and making more beans in your soup, more peas in your rice and peas can also be healthier as well. Being mindful of your drinks, because I think sometimes we sort of disregard drinks and don't think that they are part of this process that can help us to have excess calories and then excess weight. So things like the fizzy drinks, they can certainly, because they've got a lot of added sugar on the whole, can increase our weight. Sweetened fruit juices, having lots of them can have an effect. Malt drinks, which you would think would be quite healthy, when you look at the nutritional value of them, there's quite a lot of added sugar, which isn't actually very health giving. And the energy drinks as well. Having a very well balanced diet can give you the energy without you having to have the energy drinks. And alcohol in excess is what we call empty calories. It can be enjoyable alcohol, but in excess, it's not actually giving us great health. So water is absolutely fantastic. It's going to hydrate us, no calories, brilliant. But of course, you can't, nobody's going to just drink water all the time. There are other things you can have. You can add, I've had one of the best lemonades ever, which was homemade with lemons and literally water. And green teas, herbal teas, coconut water. There's lots of alternatives that you can have, and alcohol in moderation. One of the other things that you can do is to make sure that you get checked regularly. So we spoke about finding out about your risk. That's one of the ways of doing it. And that may then result in you having a blood test. But knowing that you are at risk, without doing the risk calculation, if you've got a family history, you should be having a regular blood test to see if you have developed type 2 diabetes, or if you're at risk, remember the amber range, if you are at risk of developing type 2 diabetes, so you can do something about it. Having your blood pressure measured regularly. And that may mean getting your own blood pressure machine and doing your own blood pressure at home. Getting your cholesterol and your weight checked. Look after yourself. If you've got a car, you would go and get the car MOT'd. Do an MOT for your own self. Not forgetting your well-being. Your well-being is so important. And I think COVID taught us this. We are social beings. We need to interact with people. We need to look after our spiritual health, our physical health, our emotional, our mental health. And that involves interactions with others and keeping those strong bonds, because it's really important for us as a community. We know that faith is really important. For me, in particular, I say that faith is my foundation. So, in terms of faith, if you're a faith community, together you can get healthier. So, it doesn't have to be you as an individual doing it by yourself or your individual family doing it by itself. If you're part of a faith community, why not enlist the help of the faith community? Why not make everybody in the faith community healthier? So having things like health champions or cooking demonstrations or bringing people in to talk and empowering people through knowledge that way. It could be exercise groups that you all do together or the support networks. We've got some really powerful tools for diabetes prevention. I spoke to you about those global studies and the behaviors, which was to lose weight and to do the activity. That was essentially what the pillars of those prevention studies were in those thousands of people throughout the world. As African Caribbean heritage people, we've got cultural strengths, we've got agency, and our heritage gives us powerful tools within the field of diabetes prevention. What do I mean by that? Our traditional foods are naturally rich in pulses, vegetables, whole grains. We've got that within our grasp. We have strong community bonds, a family, of community networks, and that can provide support and help us to live healthier. We tend to enjoy things like dancing, sport, and physical activity. And so why not celebrate and embrace that and do that more? And faith gives us resilience. So our faith communities are really powerful platforms through which we can get health promotion and collective change. So I come back to this risk score, which you can do. It's very easy to do. If you scan the QR code, you can do it while I finish off the talk today. But that's one way of doing it. If you don't want to do it, you can't do the QR code. At some point, if you feel you want to do it, literally type "know your risk" into a web browser and it will come up and you can answer the questions. Now, for some, having the NHS app is really helpful because why do I say that? If you do have a blood test, the NHS app will show you what your blood test result is. So those figures that I spoke about with the HbA1c, you'll be able to see what your figures are, and then you can know if you need to do something or if things are fine and you need to just have another blood test in a year or two's time. I said to you at the beginning, we do the webinar series, Diabetes Health Matters.
Sorry, Dr. John, have
yes.
you stopped sharing your screen?
Oh no, is it not moving?
Yeah, it's not sharing anymore. I wasn't sure if you were coming to the end.
Ah, right. Okay. Yes,
Yeah.
I am coming to the end, but
No, it's just fine. It's just we can't see your I can't see your presentation.
okay, where did it stop? Where did it stop?
And when you were still on the QR code.
Okay. Is it moving now?
If you, yes.
Yeah. Okay. So yeah, the NHS app I was saying, the NHS app can show you what your blood test results are, and then you can know whether you need to do anything, whether it's a matter of having another blood test, whether a matter it's being referred to one of the programs, which I'll show you about. And I was saying, can you see that now, Tayo? Yeah. Thank you. So I mentioned at the beginning, I host with Diabetes Africa, Diabetes Health Matters. We've got 40 hours of content on the YouTube channel. So please go if you'd like some more information about living with type 2 diabetes, type 1 diabetes, diagnosis, men's health, women's health, lots and lots of different subjects on there. And one of the fundamental things that I always say is each one teach one. So if you learn something today or from Diabetes Health Matters YouTube channel, then please share that with other people because the important thing is we want to have as healthy a community as we possibly can. So what can you do? today? What can you do now? The whole point of these talks is to empower people to have more knowledge and then to do something about it. There are many different things you can do. Are you going to get your piece of string out and measure your waist, measure your height? Are you going to do the risk score? What are you going to do? But it's important that you do something, even if you know your blood test is normal, even if you know your weight is normal. You can go and tell somebody that maybe they could do the risk score. So I want to come to a few resources which are available and you may find helpful. I said at the beginning, I'm one of the co-authors of the Carbs and Cals World Foods. We did this because for traditional foods and I apologize for the generic terms, African Caribbean people, our traditional foods, we didn't have sufficient information about the nutritional value in terms of particularly carbohydrate value. And so that's why we did World Foods. We present it in an illustrative way, which we hope is easy for people to understand the carbohydrate content and nutritional value of our foods so that you can make an informed choice about how much you eat of traditional foods, because we're not saying don't eat it. Remember, there's nothing wrong with our foods. What we're saying is that you can be mindful of how much of it you have and how you prepare it. Diabetes UK also produced some resources about Caribbean cuisine and African cuisine. Apologies again for the generic terms. And I did this together with Dr. Shola Aladipo and Diabetes Africa. So that's available on Diabetes UK. Just remember that eat well, move more, sleep soundly, lots and lots of water, stay connected, don't smoke, and know your figures. Check your health status and your mental, spiritual, emotional well-being is so important. If you find that you're at risk of developing type 2 diabetes, there's the NHS National Diabetes Prevention Programme, which you can be referred to by your GP practice. Diabetes UK has a lot of resources. Diabetes Africa, I've shown you some of the resources. Know Your Risk tool, we've talked about. And there will be local community organisations. And of course, don't forget your GP practice. So the wonderful Dr. Maya Angelou said, do the best you can until you know better. And when you know better, do better. So I hope you may know a little bit better today. And we're all going to try our best and do better. And I just want to say a massive thank you to you. Teo, you're on mute.
Sorry, Zoom etiquette. Thank you so much for that, Dr. Joan. For that presentation, I learned a lot. I hope you all did too. We'll swiftly move on to the Q&A session, if that's okay with you. Yes. So someone said, my father and mother both have diabetes type 2. Is it a matter of time or can I actually stop it? There's quite a few questions after this as well.
All right. So you want me to be quick fire, yeah.
Yeah.
Okay, so what I would say, absolutely. Remember what I said at the beginning, it's not inevitable. Yes, there may be a genetic push towards you developing type 2 diabetes, but it is not inevitable. There are the things that you can do, and I think it's really important that you, one, know where you're at now. So please go and get your blood test done, because I think it's really important that you know where you are, and then you can do something about it, whether it's a diabetes prevention program, whether it's now you start to move more, or you concentrate more on your weight. There are things that you can do.
Things to do, yeah. Thank
Not
you.
inevitable. It's not inevitable.
Yes. And then someone asked, is stevia a good sugar replacement? I don't have diabetes, but it runs in the family.
So if you feel you need that sweet taste, stevia is a naturally occurring product that has been used as a sugar substitute. So yeah, it's fine. If you feel that you need it, yeah, absolutely go ahead.
Yeah. And this is just a comment. Just wanted to share diabetes has impacted my family so greatly. My mom had diabetes since her 40s, and although she doesn't take insulin when she gets any cuts in her legs or ankle area, we know her 2-year journey to heal it. I think they just meant to say as you get older, it's really hard. And then there's all like the foot care and stuff like that because of like the nerve damage that can happen. As you
Of
said in the
course.
earlier slide, that it kind of affects every part of your nerve as well.
I'm sorry to hear that your mum's had difficulties living with diabetes in terms of her feet, and absolutely prevention, as they say, is better than cure. This is what this talk is about. So wherever possible, because it's not possible for everybody to avoid it, as we've said,
Mhm.
it's about preventing, and sometimes it's about delaying. But where we can, that's what we want to do. Share
Yeah.
the knowledge so you can do what you can at least. Yeah.
Yeah. Another comment, I've seen South Asians who have adjusted their diets and lost significant weight, building muscle and active, but still unable to reduce their waist size. South Asians are becoming more knowledgeable and trying to reduce risk of developing type 2 diabetes, but it's almost like they're doomed to have to these huge waists. Is there any way of targeting the waist fat?
Mm. A tricky one. I wish I knew that for myself. I think the things that we spoke about um, is the best knowledge we have.
Yeah.
So certain physical activities, certain exercises, resistance training, muscle training,
Mhm.
muscle weights, light weights, it doesn't have to be heavy weights, are things that we know can actually help to remodel your shape. So those are the things. You have to reduce your weight. That's one of the things. But in terms of the waist, it's about the muscle training.
Yeah. From LinkedIn, is our traditional tea good? Where we boil our tea and add milk. I love my tea with milk, of course, with no sugar.
Nothing wrong with our foods. There's nothing wrong with our foods.
Yeah.
So, it's, as I said, it's sometimes portion sizes, it's sometimes how you prepare it.
Hmm.
You're saying you're having traditional tea. There's nothing wrong with our foods.
Hmm. Hmm. I think it's just more portion control, if anything.
Hmm.
Yeah.
Hmm.
How much aware are mainstream health professionals, providers, which is heavily Eurocentric, of the increased risk of type 2 diabetes infection amongst people of African descent, so that obviously when they go for
Hmm.
diagnosis, they know what to do?
To a certain extent, and I think certainly the knowledge has improved. It can always improve. We can always learn more. And I think for our colleagues as in healthcare, sometimes one of the issues that is a bugbear of mine. If somebody from our community goes along wanting to know their risk, let's say wanting to have a blood test because there's a strong family history, some of my colleagues may feel that that's not the case when that person is in their 20s or 30s. But what I'm saying to you today is for us as a community, certainly there is an increased risk in our 20s, in our 30s. It's not in our 40s for us as a community. So I want to empower you to advocate to have that blood test if there's a strong family history. You say, there is a strong family history. I'm concerned about developing type 2 diabetes. I would like a blood test to check for this, please.
Thank you. From Facebook, some studies suggest cortisol and chronic stress drive diabetes in our communities as much as diet. Why is stress management rarely part of NHS prevention programs?
I think they touch on it. I don't think they focus on it.
Mhm.
But I think it is part of the package. In terms of, remember the studies that I showed at the beginning, they focus very much on two behaviors. One was weight loss and one was activity. So those are the main features that the evidence is based on, that the programs are based on. But we know as healthcare professionals, as individuals, that stress is one of the things that can affect our well-being and our sleep and our physical activity and every aspect of our life, and thereby impact in terms of the development of type 2 diabetes.
Thank you. And then someone said, I found that people adhere more to health councils when they know or hear about complications. Please, any complications of type 2 diabetes?
Complications of type 2 diabetes are many and varied. I think if you go from as I said in the talk, from the top of your head to the tip of your toe,
Yeah.
whether it's your brain, whether it's your so your brain's function, so your cognitive function, so the increased risk of things like dementia, whether it's your eyes, so the back of your eyes being affected by type 2 diabetes or diabetes, whether it's oral health, so your teeth and your gums, you know, so I'm working my way down the body. You can see tendons can be affected as well by diabetes. So you can get things like frozen shoulders, what we call plantar fasciitis, so that pain in your foot. So heart, your kidneys, your sexual organs, all of these things can be affected by, unfortunately, by diabetes. So many,
Yeah.
many and varied. And
Yeah.
that's why we want to do what we can
Mhm.
when we can to prevent it.
Yeah, because I was having a consultation with a patient who her HbA1c was through the roof, and she was put on a medication, and there's obviously medications, there's side effects, just her adherence levels were just not it. So I was having to explain that like it's not the diabetes isn't affecting her as much now, but if she doesn't adhere to these medications or we don't come to like a shared decision making, it will affect from, like you said, the top of your head to the bottom of your toes. So it can be like a deadly um disease, but when treated, it's very, very treatable. And then last question before we wrap. Sorry, were you gonna say
Sorry,
something?
and Taya, the only other thing I was going to say is that in a way, it's unfortunate. It's silent.
Yeah.
What's happening is happening in the background
Hmm.
until something sometimes catastrophic happens.
Hmm.
And so that's why it's difficult for people to sometimes take this condition seriously. But
Yeah.
I hope from today and many other healthcare professionals who would have shared this information with you, I hope that it's become clear that it's an important condition. And so to do what we can to avoid it is really important.
Thank you. And then just our final and last question. Can you be cured of type 2 diabetes?
So what we call it is remission, rather than a cure. It absolutely can happen. Similar behaviors to those that can help to prevent type 2 diabetes can also reverse or put it into remission. So we don't call it a cure because it goes away. But if those behaviors, I say behaviors, what I mean is like excess weight, physical inactivity come back, then the type 2 diabetes can come back. But you can absolutely reverse it or put it into remission.
Thank you. And this is just a final comment, sorry, before I hand out. But this is also a good time to share something with you, Dr. Joan. Multiple people have reached out to us at CAN and said that after one of your presentations, they have checked the diabetes, found out they had pre-diabetes, went to NHS and reversed the diagnosis. So thank you for everything you do. Thank you for
Thank
the
you.
presentation. That was very informative. I hope we all learned at least one or two things about it. I will definitely be checking my waist circumference and the height and half the body waist thingy you put up. Then the QR code as well. If you've not scanned it, we'll put that on our social media as well.
Thank
Um,
you.
I'd like to pass it on to Percy just to close for us. Thank you.
Thank you so much, Tayo. Thank you. And thank
You're
you,
welcome.
everyone.
Awesome. Thank you so much. Thank you so much, Dr. Joanne. I mean, I think the last comment there just sum up everything in a beautiful way. So thank you so much for the presentation. I think it was very informative. I love how practical it was. Just talking about things that we could do really. And I was even trying in the background and trying to put my hand around my waist and all of those. So thank you so much. And Taria as well, brilliant facilitating and coordinating the session, the questions as well, and how you wrote them off. So massive thanks to you both. Also want to extend our thanks to everyone on the call who has joined us. So really delighted. If you've missed any part of the session, as always, it's going to be on our YouTube. There'll be lots of details coming out based on the sessions, really. So please feel free to go back and rewatch them. So just as we wrap up, really, just a few things to bring to your notice. So as always, next week, Saturday, the Health Hour will return again with another brilliant topic. So please do well to keep an eye out for that and make sure you're attending. These sessions are for us, really, and just giving by today's session, that's enough evidence really to come back next week and the weeks afterwards. So look forward to seeing you once again. Invite your friends, invite family members as well. As you know, in Cannes, there are lots of events that we do across the year. So we're inviting you. We've got a few more coming up in the next few months. So Africa Day is this week on the 28th of May. It's going to be up in Manchester, University of Salford. The weather is nice as well this period. So do well to come up, attend it, engage as well. It will be really good to see as many people there as possible. Another event, which is only a few weeks away, is the Black Healthcare Awards. That's going to be down in London. It's a black tie event. The tickets are still up, so please do ensure you're there in person engaging. It's going to be a lovely evening. This is the third edition, so do feel free to extend it to people within your networks as well. It would be good to see as many people as possible. All our brilliant doctors that have been on the calls and presenting on various things, you're going to see lots of them in person on the day. So please do well to make sure you save that date and then try to attend. A few services that we've got at the moment in Cannes, which are definitely for us and they come into us. So we have got something on HIV and supporting people living with HIV. So please feel free. The contact details are on there. Do make sure you engage as well. If you know of anyone who this service will benefit, then please do well to refer them on. We also have got our creative health services that run on a weekly basis. So they do things like some of the things Dr. Joan mentioned, the planting and all of that. They use creativity and various things really over the week. So please do note where the various sessions are taking place as well. You can see the contact details there. You can scan the QR code as well, really, just to refer anyone in. And finally, our counseling service provision is still live and running. So if you know anyone who needs the specialized support, then please do well to signpost them. So yeah, just want to say, as always, do keep an eye out on our newsletters and various other things to see updates of what's happening. Finally, a massive thank you to everyone who has joined on the call, and also a big thank you once more to Dr. Joan and Tayo. Do have a lovely weekend. Bye, everyone.
Thank you. Bye-bye.
Bye.
Bye.
Thank you, Percy.
Thank you. Thank you, Dr. Joan. Have a good weekend.
And you as well.
Bye
And you,
now.
Natasha.
Thank you.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.